Hello everyone, in this video I'm going to show you those spots on the thoracic region that we commonly use to listen to the heart sounds. Recall we have 4 heart sounds, S1, S2, S3, and S4. Using a stethoscope we can hear S1 and S2, the ones that we refer to them as Lubb, Dupp. Lubb is louder and longer, and that one is due to closure of atrioventricular valves exactly when ventricles contract. And Dupp S2 is shorter and is not as loud as S1, and that one is due to the closure of semilunar valves. However, when I show you these spots, you note that those spots are not exactly where we have the valves. So if I place the heart here, you can see the location of the atrioventricular valves and the semilunar valves, but the spots that we use to listen to Lubb and Dupp are different. The reason is when blood flows, it transfers the sound waves. So I start with the intercostal spaces. Recall, intercostal space would be the space that we have between costal cartilages, or we can say between ribs, and it's filled with soft tissue. That's the first intercostal. This is the second intercostal. The right second intercostal space and the left second intercostal space. These are really good spots to listen to the sound S2, that is due to the closure of aortic valve and due to the closure of pulmonary valve. Then I count down, that's third, fourth, and fifth should be here. When I go to the fifth intercostal space on the left side, and then I need to move away from the edge of sternum, how far I go, I focus on clavicle, mid-clavicle. That's exactly the spot that we can easily listen to S1. By the way, in these spots we can hear both sounds, but that's exactly the place that the sound from the closure of mitral valve could be heard easily. And then if you move toward the sternum, still in fourth, fifth intercostal, that's the place that you can hear the sound due to the closure of tricuspid valve. So what I do, I quickly show you that first of all, I place the earpieces in my ear. I make sure that they are aligned with my ear canal. Then I check my stethoscope. I tap on it. It's off, so I turn it, and now it's on. And then I go to the fifth intercostal space on the left side, mid-clavicular region. That's one place. Then I move toward the sternum, fourth, fifth intercostal space. That's the next spot. And either one of the second intercostal would be again a common place that we can use to listen to S1 and S2, Lubb and Dupp. If you're wondering what about S3 and S4, even though we do not hear them, but it's good to know that S3 is the sound that we hear because of blood turbulence during ventricular filling. So think about it, when AV valves open and it's like a waterfall, blood flows from atria down into the ventricles, the blood turbulence creates a sound, that would be S3. And during atrial systole, when atrial walls contract and squeeze extra blood into the ventricles, again, we can hear a sound that we refer to it as S4. So for now, don't forget the 2 second intercostal spaces and then the 5th intercostal space on the left side, very close to the edge of sternum or moving away exactly where mid-clavicular region is.